First of all, I'd just like to introduce Dr. Benjamin Asher, who's going to come and sit here. You can have a seat. Dr. Asher is an ear, nose, and throat doctor in New York who has ended up treating a lot of Lyme disease. He's been to a number of the functional forums and has really great results, and we're excited to have him here on the panel today. We can bring it over here, Gabe, into the middle. Then the next is Dr. Howard Robbins, and Dr. Robbins is an expert in ozone therapy and is going to be talking a little bit about that with regard to Lyme disease. Round of applause for Dr. Robbins. And then I'd also like to welcome Dr. Jody DeShaw. And Dr. Jody DeShaw was trained as a pediatric neurologist in India, now practices as a doctor of occupational therapy and does bioenergetic and different types of strategies here, and has become well known in the serious Lyme world. And Dr. Mark Mendocino as well. So we've got a whole panel here. To answer your questions. So I'll get my Twitter out, but I do have a couple of intro questions first. So, Dr. DeShaw, maybe we can just start with you, seeing as you here on the end, and I can just ask you first. So, Doctor, you become a specialist in what is known as PANS or PANDAS, which is Lyme-induced autism, and that's obviously something that we're very aware of. How does Lyme disease induce autism?
PANDAS is a pediatric autoimmune neuropsychiatric disorder associated with strep. Strep is considered to be one of the co-infections of Lyme. PANDAS has now been changed, and it's being referred to as PANS to give it a slightly broader spectrum. I'd like to just start off with saying I am myself recovering from Lyme-induced Asperger's at my age. And if you find me struggling for words, word-finding difficulties, a few motor tics, it's just all part of the recovery process for me and my whole family with the Lyme co-infections, PANDAS, Asperger's. You asked me, your question was, how does Lyme induce autism?
Correct.
The kind of patients that I see in my clinic are patients that have acquired Lyme after having acquired autism or after being diagnosed with autism. And then predominantly the second kind of patient that I see in my practice is a child that acquired Lyme in utero. Through maternal fetal transfer, mostly unknown to the mother that she had Lyme disease. Dr. Mark mentioned Lyme surviving for years in the cyst form, which is mostly what I see happens, and there is quite a few number of research studies that have come out on maternal fetal transfer. As we know, Lyme disease has affinity for nerve tissue, it has affinity for connective tissue, for joints, and it has affinity for the gut. Now, when you have Lyme spirochetes that are able to generate proteolytic enzymes that can breach the blood-brain barrier, and that can also breach the zonulin-occludin tight junctions in the small intestine. That can attack the connective tissue. There are various symptoms that develop that look like what Dr. Jones calls as an autism-like syndrome. Let's go with one at a time. I've trained extensively. I've mentored extensively with Dr. Dietrich Klinghardt, trying to understand the biomedical and functional aspects of Lyme disease, especially in pediatrics. And I also work very closely with Dr. Ray Jones in New Haven. And we have several patients together that have Lyme-induced autism or Lyme complicated with autism and PANDAS. Neurologically speaking, some of the symptoms that are seen are neurological inflammation, increase in the neurotoxin quinolinic acid. We see autoimmune encephalopathy, which is development of anti-neuronal antibodies towards various targeted areas in the brain, like the brainstem, like the basal ganglia, you end up seeing symptoms like difficulty learning, short-term memory issues, rages, anger, word-finding difficulties, pragmatic language development. There are developmental delays that you see in the child. You see extreme sensory issues. You see obsessive compulsive disorders. These are your central nervous system. In the peripheral nervous system, you see you have these children who are sometimes nonverbal, mind you. They're not able to express what's going on. They have feelings of creatures crawling under the skin. They have feelings of tingling, of numbness. They actually experience sympathetic overdrive, which would be panic attacks, which would be palpitations, which would be a drop in blood pressure when they stand up. And they're not able to express. The way they express is through behavioral. Most of the children I see are also complicated with group A streptococcus autoimmunity, which is pandas. And then you see really high incidence of obsessive compulsive disorders. They have rituals. They have temper tantrums at all ages, pretty much. So overall, we see that this is looking very much like autism. Let's move on to Lyme disease affecting the gut. I don't need to go into details about leaky gut, but inhalation allergies, food allergies. Recent information is that gluten, everybody looks at gliadin, but there are actually 24 peptides or epitopes of gluten that can cause gluten sensitivity or reactivity. In addition to this, there are several cross-reactive foods that react, and the body perceives them as gluten, and you will get the same reaction as if the child had consumed gluten. So there is a lot of research that has come out recently, and there is more evidence towards looking at autism and trying to find if there is underlying chronic infections. Holistic practitioners in Europe report incidence of a rate of at least 85% of children with autism that they see have underlying co-infections. Practitioners in the U.S., from as far as I know, as a member of ILADS, the numbers they report is 20 to 25% of children diagnosed with autism may be co-infected with Lyme and its co-infections, and that's a pretty large number.
That's really interesting. So all of that, what's your strategy for treating this this complicated issue, if in a nutshell? In a nutshell, I know. Well, I do tend to carry on. It's a topic close to my heart. I've seen my son recover for the last 4 or 5 years, but sorry. That's okay. In a nutshell, we try to address in my office the biomedical aspects, and Dr. Mark very eloquently mentioned various issues, like mitochondrial dysfunction. What's coming up now is nutrigenomics and methylation issues, polymorphisms. Those become very important. For example, if a child has, if a child has a CBS polymorphism, right, you have a terrible ammonia issue in the body, in the brain, that has to be dealt with. It becomes part of toxicity management and handling. Emotional issues, psychological traumas. We deal with underlying infections. I use homotoxicology, herbology. I've mentored with Stephen Buhner. He's an absolute trailblazer with using herbs for pediatrics, for adults, as far as Lyme and co-infections go.
We also look at KPU. We look at mold and biotoxins. We would look at family dynamics. When I was training in Europe, I was amazed to see practitioners that treat children with autism will not accept a child often as a patient unless the entire family is willing to come together as a cohesive unit and be treated.
That's such a big point. I think that's a huge point, and I've seen that with your family and the way that it's a family effort, and I think that's a huge part of it. One last question I would ask, because I went to iLads in 2011, and I saw Ann Corson, who I know you train with, and I asked her at the end, I said, Ann, I know you do all of these herbs and homotoxicology, why do you not talk about that? She says, well, I can't talk about that at iLads, you should come and hear my ACAN presentation, I talk about it all then, right? So I thought that was interesting, but then I saw that now you are speaking at the iLads conference, and you're doing homeopathy and herbs and doing, Klinghart's kinesiology. How are you able to overcome this barrier? Because I spent my first 7 years of my life working in this world, working in this world of homotoxicology and herbals. How have you been able to sort of open this up, and how are doctors reacting to these new methods that are a bit outside of their box and their toolkit?
All that really matters is results, isn't it? I've been blessed at being able to train with some of the world-renowned physicians that I mentioned, and I've trained in autonomic response testing with Dr. Klinghart, and it's been, you can call it a coincidence, but the patients that I see in my clinic that I have tested with muscle testing, but it's not just muscle testing, it's autonomic response testing, which I found is the most sensitive. It's based in quantum physics. It's based in Dr. Fritz Albert Pop's bioluminescence and biophoton theories. And the results have been accurate in the sense that when I've had the children come to me and we've done a full series of muscle testing, they've gone to Dr. Jones, who's run labs, and the results have been more or less identical. Then we've had children who've been on antibiotics for several years, have not gotten better. Dr. Marks spoke about biofilm. He spoke about mitochondrial dysfunction. He spoke about addressing toxins in the brain. Those are the aspects that I have addressed, and we have been able to take 18 to 20 months, shave that time right off the antibiotics that are needed for children, actually for the parents that choose to go down the antibiotic route. Yeah. That's just
so the results. You've got to get the results, and that's it. Well, I really appreciate that, and thank you so much for sharing that. I'm sure we've got some questions coming in on Twitter already, so I'll do that. Dr. Asher, if I can move on to you for a second, how does an ENT doctor end up treating Lyme? Why are you doing this, and how's it happened?
Well, when I moved to New York 10 years ago and opened up my practice here, I moved from Vermont, and the Lyme epidemic hadn't hit there, and I actually didn't know much about Lyme disease, but my practice is one where I basically treat chronic illness as it relates to ENT, and what I discovered is that a lot of the chronically sick otolaryngology patients actually have Lyme disease. So some of the conditions of fluctuating hearing loss and dizziness and tinnitus and sensitivity to loud noises were all conditions which appear to be, in many of those patients, they actually have Lyme. So I started testing. I was testing my patients, and I started treating them, and found that I was getting very good results. I actually had a patient once who came to see me. The thing that really blew me away is that a patient that came to see me had a fixed sensory neural hearing loss for 7 years. He had been diagnosed with Meniere's syndrome, and he was so dizzy that he actually couldn't find his way home from his office. And he'd had Lyme disease 7 or 8 years prior to seeing me, and I said, I think you probably still have Lyme disease, and I put him on antibiotics, and this fixed hearing loss that had been there came back. His hearing came back to serviceable, almost normal, and I was just, that's something that you just don't see in otolaryngology. And the problem is that in the ENT literature, the concept of Lyme and sensory neural hearing loss exists, but it said it doesn't matter whether you treat it because it doesn't work. And basically it's based on studies that you treat people with 10 days of doxycycline. Of course, nothing happens. I became very interested in a lot of these conditions. I started treating and having very good results.
So outside of what Mark spoke about with the sort of general functional medicine model, what are some of the things that you're doing that seems to be really working for the treatment there? Because I know you've developed quite a well-known practice for doing this in New York now.
Well, I use a combination of treatments. So I use antibiotics, I use herbal therapies, and I use some German biological homeopathic remedies as well. I mean, I think that if anybody tells you they have the answer, they don't. So it's basically it's an ongoing work in progress, and it's a matter of trying new things. Every patient that I see is a different situation. Some people, you put them on a long course of antibiotics and they actually get cured, and that's the end of the story. Other patients are, so sensitive that if they even see the bottle of antibiotics, they fall apart. Yeah. So the question is what to do with those people. So it's trying to find the right protocol that's going to fit each patient. And having as many tools in your toolbox is the thing that's necessary to make a difference. And that's why some of the more milder homeopathic remedies are really helpful.
So I've got Dr. Lana Hirsch here on Twitter has asked a question. How can I learn about how to treat Lyme without taking out a second mortgage on my home? Would you answer that? Maybe I should save that one for Mark. Where did you sort of learn this, and what's been your iterative process of getting into it?
Well, I learned by experience and by talking to my colleagues who treated Lyme patients. So first of all is to not be afraid to take on patients and being challenged by people who have conditions that you're not entirely comfortable with, and realize that there's no cookbook. So you can't practice cookbook medicine no matter what, and you have to start thinking, well, maybe there's another way to do this. Who am I going to ask people, and then decide, treat as far as you can, and then when you can't treat any further, then send them on to the next person. Eventually, you treat more and more people, you start getting comfortable. I mean, the first Herxheimer reaction I had with antibiotics, I was like, oh my God, this is really scary. I thought my patient was going to die. I was so worried. But after a while, I started saying, oh, this is what happens when you treat people. Yeah. So you get more and more comfortable with it, and then the more comfort you get. I think part of it is also that I'm a surgeon by training, and I think that surgeons tend to be practically oriented people, and we are results oriented. And and I was comfortable in taking care of some of the sicker people too. So
that's great. Dr. Robbins, I know when you came to New York, you were an O2 guy. You were all about the oxygen bars, but now you're an O3 guy. You're more of an ozone guy. So tell us a little bit about that transition. And look, a lot of people are interested in ozone therapy. It's obviously interesting. I see it being used. I was looking at the other day, Hertz Rent-A-Car now. You can smoke in the car because they ozone the car at the end and they can get rid of the smoke. Right. So I thought that was a cool thing that I saw, and I think ozone is growing in popularity for all sorts of cleaning. Why do we need to know about it for Lyme?
Okay. Well, first of all, thank you for having me, and thank you all for coming. We've been throwing out a word that I don't really feel moral or ethical to use, but I'm going to use it tonight, the word cure. I don't think a doctor should ever use that word or even promise or guarantee a result. Even if I've been successful 10,000 patients in a row, how do I know for sure I'm going to be successful on 10,001? Yeah. Having said that, and putting that aside, I've only seen stage 3 and stage 4 Lyme, whatever that is. I'm told it's the worst stages. I'm not an infectious disease expert. I'm an expert on how to get rid of infectious disease using ozone therapy. Yeah. And I've only gotten rid of it in every single patient. That's it. We haven't failed yet. This is my 24th year doing ozone therapy. We've done over 200,000 total therapies, about 10,000 treatments a year now. My patients are from all over the world. I train doctors from all over the world. I think this is important to say at this moment. A man who got me started in this, along with Dr. Robert Atkins back in 1990, was Gary Null, who many of you may know. Gary did a documentary called Ozone Therapy, The Miracle Medicine, just a couple years ago. I'm prominently on it, I will say, and you learn about ozone from A to Z. But he interviewed about 150 of my patients, chose about 40-some. And he chose 3 Lyme patients in a row that are on there, all telling you how they had stage 4 Lyme with all the neurologic problems and symptoms and how it worked. But here's why it works, okay? So we fill up a syringe, and it looks empty, but if it empty means air would be in it. Air is mostly nitrogen, and nitrogen would embolize and kill you instantly. Yep. And New York State has a rule. You're not allowed to kill one person with functional, alternative, holistic, complementary medicine. But with my prescription pad, it's unlimited. Okay.
I think that's called the null rule, the null effect, right?
But it's basically the syringe is literally only filled with medical grade O2 oxygen and O3 ozone made from the oxygen. When ozone goes in the body, it indiscriminately kills every virus, every fungus, every yeast, every mold, every spirochete, every bacteria, every toxin, every harmful free radical. It even chelates toxic metals off nerve tissue, both peripheral and central nervous system, brain tissue, because it bypasses the blood-brain barrier. Because it does this and kills everything that doesn't belong there, I'm actually a hired serial killer, we win. Because, as you said before, I don't look on fibromyalgia as a disease. It's just a symptom of another condition. Everybody in this room has had an antibiotic even once in their lifetime. They all suffer from candidiasis. If you look up symptoms of candidiasis on the internet, every disease symptom is listed there. So what are you treating? The very first person on that video had multiple sclerosis, so we got rid of his MS. They couldn't get one person on herpes to come down until I called his wife up because I gave her husband back. She came and was willing to be interviewed how ozone got rid of her herpes. But with Lyme, we've had nothing but success in the worst cases because it kills all these different things. Now, from 1990 until about 3 years ago, I really didn't care about the rest of the world. I was very introverted in just helping and treat the families and people that I see in my office, and that was it. I am a Rotarian, and I decided that it wasn't moral and ethical to hold back what I do. So I went to the American Academy of Ozone Therapy's first meeting, and then I went to the International Association for Ozone and Healthcare and Dentistry's first meeting, and I let them know I exist. Next year, I was a keynote speaker. And the Robbins method and protocol, apparently I came on how to do it safely. Now, up until now, there have been 3 or 4 ways of doing intravenous ozone. You can do ultraviolet irradiation of blood. We did that early on. Helps a lot of conditions, gets rid of nothing, has a lot of risks, costly. We did 45,000 major autohemotherapies. That's where you take out a pint of blood, you ozonate it, and then you put it back in. That's the one used mostly around the world. So I have a unique experience doing 45,000 of them because apparently that's more than all the other doctors that do it in the U.S. put together to date.
I mean, that's an interesting point. You mentioned that earlier. Like, if it's that successful, why I didn't know. Like, when we first talked and you said that you were doing this, I was like, why isn't everyone doing this? This sounds like a no-brainer. What do you think? Why hasn't it caught on?
Well, that's a good question. And just to say, as part of that answer, it's been used for over 70 years in the modern ozone world, now by over 45,000 physicians in over 50 countries daily worldwide.
Okay.
As Frank Schallenberger, an MD friend of mine from out in Carson City, Nevada, always says on his emails, he goes, if ozone were a patentable medicine, you'd find it in every hospital. Since it's not patentable, there's no money in it for the pharmaceutical companies. Follow the money trail. Yeah. That's as simple as that. I'm going to be lecturing in Cuba in September at a big world congress. They invited me to come and lecture.
Do you think
I'll
they'll
be
let you
lecturing
back?
at their medical school. If I can get out of the country after I tell them...
but I got a British passport, so I just sort of did a little
Well, we're doing
switcheroo.
it legally with a visa and licensing from the State
good,
Department.
you're right.
We're leaving from Miami
Okay,
on
perfect.
a chartered flight, so it's obviously very safe to do this. And my expectation is after my lecture, I'm going to be showing them how they can, I'm using this word again, cure so many illnesses from AIDS to hepatitis to Lyme, herpes, multiple sclerosis. I'm actually having really good, I don't want any autistic children. Emotionally, I can't handle it. God bless you. You're amazing to do this. But I've had some great results with autistic kids because I believe whether it's viral, bacterial, or toxic metal in the brain, ozone will chelate it out and destroy them. And that's why I've had some amazing results. It's long term. It's not a fast fix. Yeah. And with Lyme, like you said, I tell patients you're going to need a long time for this, like these people on the video. 18 months, maybe 2 years even. But within weeks to several days, not several days, but even from weeks to a month or two, major differences in their symptoms. Major differences. By 8, 9 months, in most cases, doing it at a minimum of only 3 times a week. Not my fast track protocol, which is 12 treatments a week, 2 a day, 6 days a week. You see major turnarounds. They feel like they're normal again. But I believe it because it hides away in every tissue, in the cerebral spinal fluid, in the lymph system. It's so pervasive. You've got to hit those. When they come out of their Batmobile, the spirochetes come out of their shell and whatnot, you've got to be there to kill them, and it takes a very long time to really affect that. Now, if you add on what everybody else does in this room to what I'm doing, now you have an even faster result and more efficient result. I'm a Johnny One Note. I do ozone. I rather work as a team with everyone else who studies every supplement. I stopped doing that. I don't want to know, is zinc piconolate the right zinc to take? How often should you take it? What time of day? How much? How not? What source to take it from? You can do that. I don't want to do that. I just do ozone. Awesome. And the results speak for themselves on the video and from my patients. All my staff that works at the front desk are patients of mine, or were patients of mine. 2 of them had stage 4 Lyme, and they're now functional, normal human beings again, awesome. Able to work for me.
Thank you. Thanks for sharing that, and I appreciate you doing that. We got loads of questions coming in from Twitter. So, Mark, can I ask you this one, Mark? What is the cost? This is from Jeff Glad, listening in Indiana. Hey, Jeff. Yes, and to answer your question, yes, you will be on the Mount Rushmore of the Functional Forum. What is the cost and insurance coverage for the iSpot test?
The iSpot is $389, and it's actually in review with the New York State Department of Health, so it actually is available to be used here in New York currently.
That's a big thing, because I know...
The website is www.iSpotLyme, little I, with the word spot, the word Lyme.com, and you can use that to get access to the company. And again, it is available in New York State. The Department of Health is reviewing it. We expect them to approve it.
That's big news, because New York doesn't get any of the tests. Dr. Asher, we've had a question here for you. This is from Terry Cole, who's in the house. Terry, where's Terry? She's not here, but there she was here. Terry asks if city dwellers need to be worried about Lyme disease.
Unfortunately, I think the answer to that question is yes. I had a patient who got Lyme disease in Riverside Park. And one of my colleagues was telling me that one of their patients actually found a tick. They hadn't left their concrete confines of their apartment and wherever they walked and actually the tick came in through their building. It was on their wall, and they were bit from there. So it is, it's not a high risk. Obviously, you're much better off in the city than you are walking around through the tall grass in the Hamptons, but you can get it in the city.
Yeah, sure.
So I ride my horse in Muttontown Preserve, and I can tell you without a doubt, Lyme ticks were about the size of the top of a number 2 pencil eraser. Okay. They're airborne. You don't have to be anywhere near a park. They can just be taken up into a good gust of air, travel several hundred miles, fall down, land on your head. You won't even see the bullseye lesion there, and they bite, they fall off, or you scratch and they're gone. Yeah. And now you've got Lyme disease and you live in the middle of an urban area. Never been to a park in your life.
That's so interesting. Yeah.
This kind of also gets back to that environmental pressure. In the Grand Tetons, where I live in Jackson Hole, traditionally there's never been ticks on the mountain routes. Now the mountain routes, when we rock climb on them, they are loaded with ticks. 15 years ago, they weren't there at all, and now they're loaded with them. So there's changes coming.
Yeah. Jody, yeah.
Studies have shown that ticks are not the only vectors that transmit Lyme. Your common mosquito, bed bugs, head lice transmit Bartonella quintana. So there are other vectors that can transmit Lyme disease and co-infections as well.
That's interesting. Let's have some questions from the audience here. Yes, Dr. Jill Barron.
How do we prevent Lyme?
Yeah, prevention.
Do we have any lotions or creams? How do we live?
Jill Barron asks, how do we prevent Lyme disease? Mark?
The company Pharmacen that does the eye spot Lyme actually just produced a tick kit that will be sold nationally. If you do get a tick, it's a little fork to get it off, put it in a container, ship it to the lab. They'll tell you what's in that tick if you got bit, which is another way to kind of end around whether you need to be treated or need to be worried about. The Lyme vaccine, which you've all heard about, I think is kind of a false way to go because of all the co-infections. And so I think that's not going to pan out to be.
Death.
I think it's all about the terrain in your body. If you adopt a lifestyle that maintains a healthy terrain that is unhealthy for excessive microbial growth, that is a big step towards living clean. I don't want to get into all that, but organic foods, what you cook in, what you put in your body, daily exercise, emotional health, forgiveness, spirituality. I think all of this plays a very big role.
I really appreciate you offering that because that is really the functional model that Mark is talking about, and and I think that's the medicine that all of us. It's very easy to get very scared about what's happening, but I don't think that's a good position to be as well. Look, we're very resilient, we're very adaptable, and the terrain is something that's ultimately under our control as well. Dr. Ash, you want to add something?
I would concur with that, and it is the question you ask when you see so many people with Lyme disease, and some people, the only complaint they have is their fingers are a little bit swollen, and that's it. And then other people are totally devastated. And I'm sure that some of that has to do with the virulence of the organisms, but a lot of that has to do with the host. And I think that those points are all very important.
And that's why I had to have Latham on here to speak about what Latham spoke about with the toxicity, because we have to start at, that's at age 0. A toxic environment is going to allow these microbes to breed and do things that they shouldn't be doing. That's the ultimate upstream medicine. That's why I think it's a great fit to have her in today. You'd like to add something?
Well, I was just going to say that cleansing I like to be a little bit happy about things at times, but cleansing, detoxification, Jill, using all the things that you do in your practice, strengthening the immune system. I'm sure people get bit by Lyme ticks and don't get Lyme. I'm sure it happens all the time. If we can't do anything with the environment. All we can do is fix our internal environment, make it so strong that nothing can live in us that we don't want to have live there, and then just be careful.
This makes me think of when I was asked to vaccinate my children for HPV. Why do some people clear HPV and others don't? It may be that terrain. And I think this new world of functional genetics may shed some light, which Dr. Jody was talking about, looking at your genetic SNPs to look at what your predisposition is to optimize the terrain. That may be the next forefront where this all moves to.
Can we have a large round of applause for all the panel? Thank you, guys.